depends a little bit on the presenting complaint of the patient, but in general terms, it's really important to have good and adequate lighting. We also use supplemental lighting as well, so we often have some form of magnification and light source, as well as using a dermatoscope as well, particularly looking for skin malignancy or looking for a skin cancer check as well. In terms of doing the actual consultation, it's important to let the patient know that they may need to remove quite a bit of clothes and actually ask them if they want to have a chaperone in the room for that, particularly if exposing, chest and genital areas. It's important to have a systematic approach if we're doing a skin check, particularly for skin cancer. So most dermatologists will usually start from one side of the body or one area of the body and work their way down. When I do this, I actually have the patient seated first, and I start on their scalp and face because often patients are too tall for me, I can't see. So we start them seated, we work our way down. From there, I get them to remove the top half of their clothes so they feel as though they're not removing all of their items of clothes, and I'll do the top half of their body, and then we'll get the top half back on and then do the bottom half of the body, either with them standing and me down near the ground, or getting them on the bed and then flipping them over and also examining their feet. It's important in dermatology though to examine all areas, so you might want to ask them if they do have any concerns in their genital area or on their buttocks. It's also important to examine their feet. So a lot of people, when they do a skin check, they take off all their stuff except for their socks, but it's important to check that area because there is still a potential chance to get things like melanoma even on the plantar surface, which is the bottom of the feet. Also checking out the nails as well. So when we think of skin and we do a general skin check, we look at the skin, but we also look at potentially the mucosal membranes, we look at the hair and the scalp, and we look at the nails as well. If general practitioners are struggling a little bit with a condition and they're either not sure what the condition is, or it's not responding well to the treatments that they've done, and they get a feeling like the patient's getting a little bit frustrated in terms of not getting better, then that would be one reason to refer. Another reason to refer is that there are some medications in Australia that are only able to be prescribed by dermatologists. So an instance for that is with acne management. To get isotretinoin, it has to be prescribed by a dermatologist or a doctor under supervision of one. And a lot of the more advanced therapies for things like eczema and psoriasis are actually only able to be prescribed by dermatologists. So that would be another setting in which referral to dermatology would be necessary.